guys, today we are going to discuss about cyanide poisoning. Cyanide is highly toxic chemical which is widely useful in the research and commercial laboratories and in many industries. Sources, its gaseous form is hydrogen cyanide, which is important component of smoke in fires, cigarette smoking, burning of plastic. Cyanide also found in some plants. Okay, they are in the seeds of the apple, apricot, plum, in plum amygdalin, roots of cassava, lima beans, linamarin, which is a toxin, and grains of sorghum, durin. Cyanide, which is generated by breakdown of the nitroprusside. Nitroprusside is potent antihypertensive. So, on excess dose of this nitroprusside as an antihypertensive dosage, you will find more amount of cyanide will be generated from the nitroprusside, which leads to poisoning. Okay, so you should monitor when you give nitroprusside as antihypertensive. You should monitor the dose and you should give them proper dose. Otherwise, it may lead to poisoning. And cyanide, which is also formed by the metabolism of acetonitrile. Acetonitrile is used as solvent, which is found in some nail polish removals. If some members drink this nail polish removal for suicide purposes, then due to the presence of acetonitrile in the nail polish remover, from the acetonitrile cyanide will be generated and the cyanide poisoning will be absorbed in that person. Okay, mechanism of action, how this is mechanism of action is occurring. Cyanide, first through inhalation it gets rapidly absorbed into the blood. Okay, and skin absorption or ingestion also, these are the routes of absorption of cyanide. So it disrupts the cellular function by inhibiting the cytochrome oxidase, and it prevents the cellular oxygen utilization, resulting in the histotoxic anoxia. What are the clinical features in case of cyanide poisoning? Cyanide is the most rapid of all poisons. Okay, inhalation, on inhalation it causes immediate loss of consciousness followed by the convulsions and death. So ingestion, slower onset of action. CNS effects are headache, will be seen anxiety, ataxia, confusion, convulsions and coma. Okay, in CVS, first there will be bradycardia and hypertension, which will be followed by tachycardia and hypotension, and arrhythmias also will be seen. In respiratory system there will be dyspnea, tachypnea and pulmonary edema. GIT, you will see you will find nausea, vomiting and abdominal pain, and the odor of bitter almonds will be detected from the victim's breath or in the vomitus. Okay, you will find some kind of odor like it is the oil of bitter almond odor. Okay, so you will find that odor in the victim's breath or in the victim's vomitus. Okay, skin will be seen as a bright red color or cherry colored skin, and mucous membrane, which is, mucous membrane also will turn into cherry red color, which is characteristic due to increases oxygen saturation in the venous blood, not in the arterial blood, the venous blood. So first you have to remove the victim from the exposure, and for suspected cyanide poisoning due to nitroprusside infusion, you should stop the antihypertensive infusion, and for cyanide ingestion you should administer activated charcoal, because the activated charcoal will absorb the cyanide. So what are the antidotes for cyanide poisoning? First one, methemoglobin generators. So you should generate methemoglobin for a purpose. Now let's discuss how the methemoglobin help us eliminating the cyanide. So sulfur donors and direct binding agents, okay, like chelating agents. So methemoglobin generators, these are nitrates. So amine nitrate, sodium nitrate, methylene blue, and phenols also. Phenol 4-dimethyl aminophenol. With hemoglobin generators causes oxidizing. These are the potent oxidizing agents which changes Fe+2 form. Fe+2 is normally present in our hemoglobin, right? This will be converted into a storage Fe+3 form. Okay, so Fe+3 is found in the methemoglobin. Now there is methemoglobin formation. Methemoglobin binds strongly with the cyanide than with the cytochrome oxidase. So normally cyanide also, in mechanism of action we saw that cyanide inhibits the cytochrome oxidase. So this already there will be a formation of cyanide cytochrome complex. Okay, and there is a inhalation of cyanide, there is already formation, rapid formation of cyanide cytochrome oxidase complex. Now there is methemoglobin generators. They binded with the hemoglobin. They form the methemoglobin. This methemoglobin has a main affinity with the cyanide than with the cytochrome oxidase. So it leaves the cytochrome oxidase complex as free and as by binding to that of the cyanide. So there is a formation of cyanomethemoglobin and there is a free cytochrome oxidase there. Next one is sulfur donor. Sulfur donors will give sodium thiosulfate. Cyanomethemoglobin, which is formed by methemoglobin generators, needs sulfur donor for its detoxification. So thiocyanate should be given. It is harmless and it is excreted in urine. So cyanide plus thiosulfite gives rise to thiocyanate plus sulfite. This thiocyanate will be excreted in the urine. Direct binding agents like dicobalt edited and hydroxycobalamin. Hydroxycobalamin plus cyanide gives rise to cyanocobalamin. Next, how should we administer these antidotes? So, two methemoglobin generators are needed and one sulfur donor which are used in this. First, you should administer amine nitrate by inhalation. We should break the ampule, we should soak in the handkerchief and we should ask the patient to inhale for 30 seconds. Second step is administer 3% of sodium nitrate solution, 10 ml intravenously very slowly. And third step is administer 25% of sodium thiosulfate, next sulfate solution, 50 ml IV and by slow IV infusion. Nitrates may cause hypotension and dangerous levels of the methemoglobin. Okay, so you should monitor them, okay, while giving these. After that, coming to postmortem appearances, rigor mortis occurs early and it lasts longer period. Postmortem staining, red or cherry red color, frothing from the mouth and nose, smell of bitter almonds on opening the body cavities, hemorrhagic gastritis if the poison is ingested. Okay, on ingestion, okay, you will find hemorrhagic gastritis. Viscera and blood will be cherry red or bright red in color. So that's it, guys. Thank you all.